on behalf of World Vision Malawi, I will share some experiences based on the topic that were assigned. It's something to talk about contribution of agriculture to nutrition and healthy outcomes. And this is purely based on our own experiences in World Vision Malawi. Maybe I should not bother introducing World Vision Malawi with respect to the kind of interventions, because I guess most of you are familiar with what World Vision is doing, having worked with World Vision in one capacity or the other, and of course having interacted with many of you in different forums. But just to highlight the fact that World Vision pursues development goals through 4 key major outcomes, and one such outcome that we pursue looks at good health for children. We are primarily a child-focused NGO, but we also consider good health for families and community members. And so it's quite inevitable that we can achieve this outcome without using food. In that respect, we acknowledge the fact that food is a primary tool for nutritional well-being. And so I'll try to share some experiences based on some research that has taken place in many of our programs, which on average range from 10 to 15 years across the country. In order for us to achieve this outcome on good health, for nutritional well-being, World Vision also pursues an integrated approach which promotes food security through agriculture, as well as health, water and sanitation, HIV and AIDS, among other key thematic areas. The experiences that I want to share with you, like I said earlier on, are based on research work. Time and again we do have either baseline studies at the beginning of the programs, but we do also have some mid-term and end of project evaluation. And from a number of such studies, we try to distill some of the key issues which I would like to share with you. Basically, in that regard, with respect to the topic here, to assess the contribution of agriculture towards nutrition and healthy outcomes, we want to approach it from the food security premises by looking at the 4 pillars of food security, where we talk about food availability, access to food, utilization, or processing and utilization, but also creation of wealth. And our attempt to look at how these contribute to nutrition and healthy outcomes based on the experiences that are shared. Under food availability, as I said earlier on, food obviously is a primary tool that we use to promote nutritional well-being. And so, from the studies that we have had some confirmation or some kind of encouragement that indeed promoting food availability through different interventions like agricultural diversification, which looks at a wide range of crops as well as livestock, has made some positive contribution in different ways and in different programs. Something which is very obvious is that through crop diversification, it has been possible to guarantee access to a number of food crops with different nutritional contents at more affordable, using more affordable means. Because as you may expect, throughout the diversification, you also have crops that provide energy, like my colleagues presented here, some that provide vitamins and other nutrients, as well as cheap sources of proteins. And so, as an example, in one of our programs, or in 3 other programs in the north, the Sept and the south, we have indeed observed some positive trends with regard to under 5 nutrition, or rather underweight among under 5 children, like in one of the programs in the south, where at baseline we noticed that underweight was a serious problem, measuring 28.2%. After some years during the midterm, we noticed that we had registered something like 13%. Similarly, in programs that have promoted livestock and fish farming, like in the north and the south, we have also seen similar trends in terms of underweight dropping over a number of years, from as high as 27.7 in some cases to 3.2%. Of course, stunting still remains a big challenge, but in some cases we have actually registered something like 29%, which is quite exceptional and somehow a challenge to sustain given the natural shocks that we go through. I also need to highlight the fact that we do have some special projects which are primarily focusing on micronutrients, and these two have contributed positively. Like at one point we had the micronutrient and health project, which ran for something like 11 years, and this project, through promotion of food availability, food processing, and even food fortification, registered some good progress. I needed to say that we had a special interest in the trends for goiter among school-age children, which drastically dropped through food fortification. But one of the pillars, like I said, for food security looks at asset creation, and this is achieved through economic empowerment. Some of those interventions that we are following look at seed multiplication, dairy farming, and other discrete economic empowerment programs. These, of course, do contribute towards access to food, but at the same time, they are quite critical to improve the household resilience during natural shocks. And that's very important because that's when we register a reversal trend in most cases in nutritional well-being of children and communities. And so, having said that, it's really quite obvious that there is great potential for different players to consider the agricultural, nutrition and health nexus seriously, in order to improve nutritional well-being. But of course, there are other key factors which I may call drivers that are also critical for us to sustain good nutrition amongst children, community members and their families. And the aspects of water, sanitation and health are quite critical in order for us to manage some of the common diseases that can have a negative impact. We also have some debatable issues or factors that are inherent in our society, which can also have an impact in a negative way. Nevertheless, World Vision has a strong buy-in to integrated program delivery in order to ensure that we have a positive contribution on health and nutritional outcomes using agriculture as one of the key means. Thank you very much.